In this video, I wanted to make a quick little review of the broad topics we've covered leading up to this first exam of ours. I wouldn't necessarily see this as the only review you need to do, but just as more of a topical outline of the things we covered. So in week one, we talked about really basic things like what the anatomical position is, which is the position that the skeleton is in right now. We talked about anatomic terms like anterior, the front of the body, posterior, the back side of the body, medial towards the middle, lateral towards the outside, inferior, superior, all those other things. So that's something to really drill and make sure you have all that down. We also, in our first week, talked about the fundamental planes of motion, so that sagittal plane, like this, the frontal plane, sometimes also called the coronal plane, like this. And then, of course, the transverse plane, which cuts across like this. Occasionally and almost interchangeably called the axial plane. We also talked about how we can think about rotations in a plane as being a rotation around an axis. So, for example, if we're talking about a plane like this, having something spin in that plane is the same thing as saying that something is spinning about an axis of rotation that's perpendicular to the plane. So I can give a concrete example of that. Let's maybe take the I think I probably overused the sagittal plane. So let's talk about a rotation in the transverse plane. Maybe twisting the torso. So you could imagine like twisting the torso like this. You could equivalently think about that as a rotation in the transverse plane, meaning some point on the body, like maybe right there on the rib cage. As the torso twists, it stays in the transverse plane. Or you could think about it as everything is spinning about an axis of rotation that's perpendicular to the transverse plane. So that's the idea about rotating in a plane. By the way, you should also remember you can rotate in planes that are not fundamental planes of motion. I think the best example maybe being the subtalar joint, which has an axis of rotation like this, which means the subtalar joint is a rotation in a plane sort of oriented like that. Then in week two, we talked about how these motions can be described with terms like flexion and extension, internal, external rotation, adduction and abduction. We talked about some of the particulars of how pronation and supination can mean something at the wrist and something different at the subtalar joints. And I think we talked about a few of the other kind of oddball motion terms like for example, the radial and ulnar deviation of the wrist. We also talked about setting up a joint coordinate system or a joint convention. So, for example, if we're talking about, the ankle joint, we said that you need two things to be able to adequately describe an ankle joint angle. Those two things being, number one, what is your definition of 0 degrees? And number two, when you say positive direction, what do you mean? So maybe we might define the ankle joint. This is like the shin here and a really simple foot. Maybe we say I'm going to define standing in this neutral anatomical position as, say, 90 degrees. And I'm going to say ankle dorsiflexion, so moving the ankle up like that, maybe that's positive. You could come up with a different ankle joint angle convention, and that would be fine. But you just need to be explicit about these two things, what's 0 degrees and what's a positive angle. And on the exam, when I ask you questions about joint motions, there'll be this information will be provided, or having it not be provided will be part of the question. In week two, we also talked about the different types of joints. We talked about hinge joints, like maybe the elbow or the knee being a classic example. We talked about the ball and socket joint. The hip is a good example of that. We talked about ellipsoid joints, like the wrist. We talked about saddle joints, like the thumb, less common, but occasionally you see them. We talked about pivot joints, which are like a hinge joint turned on their side, maybe the cervical vertebrae, a good example of that. And then we also talked about the ideas of degrees of freedom. I often abbreviate as DF, and that's like how many different directions can you move in at a particular joint. So a hinge joint, like maybe the most simplest way of representing the knee, might just have 1 degree of freedom. It can flex and it can extend. Something like a ball and socket joint here that has 3 degrees of freedom. Right? It can flex and extend, it can adduct and abduct, and it can internally and externally rotate. An ellipsoidal joint, like the wrist, in contrast, just has 2. So the wrist can medial and laterally deviate like this, and it can flex and extend like this. The ability to rotate at the wrist joint have apparent rotation occur actually comes from rotation about the forearm. Finally, we talked about a little bit of a more advanced topic, which was this idea of generalized coordinates, and that is a useful system for being able to describe complex joints or complex motion, like, say, the shoulder girdle, or more sophisticated treatments of the knee where we're interested in how the patella moves as a function of how the knee flexes, or how the tibia rotates internally as a function of how the knee flexes. So just remember, with the generalized coordinates, the idea is that we can collapse some of the complexity down into a smaller number of parameters to give us a set of tools for intelligently thinking about complex joint motion with a relatively small number, or with a relatively few parameters, quite often only 1. Then during week 3, we talked about medical imaging, so the various techniques that you might use to peer inside the body or to learn important parameters about the body. So we talked about x-rays, we talked about CT scans, we talked about MRIs, bone scans, sometimes also called bone scintigraphy. We talked about DEXA scans, and it's worth reviewing the variety of situations where you might want to use them, or you might want to use information from them. So, for example, I know one of the examples I gave was being interested in the localized bone density at the femoral head, because it's a place where elderly people often fracture their femur. Great application for the DEXA scan, right? Whereas if you have maybe a football player with some nondescript groin pain, maybe you want MRI, because that's something that you can get both soft tissue and bony tissue out of. Then in week 3, we also talked about graphically interpreting kinematics. So we started creating graphs where on the x-axis we had either time, or sometimes also, if it's a cyclical motion like walking or running, or maybe a bicep curl, you might have like percent of the gait cycle if it's walking. So you might see like going from 0 to 100%. So this just means like from when your right heel hits the ground to you take a full step, and then your right heel hits the ground again up here. You might plot some parameter of interest. You might plot, I don't know, the knee angle as a function of time. And so maybe the knee is like mostly straight here, and then it flexes when you're swinging your foot, and maybe it extends a little bit down here. And interpreting these graphs, we again need to know those 2 very important things about setting up a joint coordinate system. Number 1, what's 0 degrees? And number 2, when we're going positive, what does that mean? Quite often you'll see people label, and I try and do a good job of this too, is actually labeling my axes like maybe flexion this way and extension this way, so that I know when we're talking about this point, we're talking about when the knee is flexed. We, in the context of those graphs, we also encountered a few points of interest. Those being, number 1, the point of, and let's just say this is flexion and then extension down here, the point of maximum flexion, the point of maximum extension. We have the range of motion, sometimes also called excursion, which is like the max minus the min. It's like sort of the total range of joint angles that you sweep through. And then I think a few others. So this is going to be important concepts to master because we're going to start plotting additional things like forces or muscle activation or joint velocity, things like that. We'll start plotting those on graphs like this as well. And then lastly, we looked at a few different applications of how you might actually measure kinematics. So using some of the motion capture techniques that like a biomechanics lab might have, all the way down to something as simple as taking a video with your smartphone. So check your notes and check my lecture notes about what the particulars are with those, because we'll want to know, for example, what are the circumstances in which we can or cannot rely on some of those techniques to get a good measurement. A few of the highlights would be that, number one, if you want to know a joint angle, like say the knee angle, you need to know the orientation of the segments on either side of that joint. So I need to know where the thigh is, and I need to know where the shin is if I want to measure this angle. So that's why, for example, and I think one of the quiz questions last week, there was a figure from a study looking at shoulder angles in surgeons, and they had one device, one wearable device on their torso and one wearable device on their upper arm, so that you know where the torso is and you know where the arm is, and you can measure the angle between it. Then the other big issue with trying to get 2D joint angles out of say a smartphone video or photograph was the issue of perspective. So you really do want your camera pointing straight at the plane of motion you care about. So maybe if you're doing, I don't know, a barbell deadlift, that's a primarily sagittal plane motion, right? Kind of drawing the sagittal plane here. So you want your camera facing straight on that plane. So broadly, those are the topics that we covered. Obviously, this video is probably not enough for you to recall all of those in detail. But hopefully it kind of refreshes your memory and allows you to think about some of the topics you know well, some of them that you don't know well. And then lastly, I just want to maybe suggest what or remind you of your sources of studying. Sources, yeah. Things to study, maybe. So obviously your own notes, my notes, lecture notes. Obviously, one of the benefits of the online classes is that if you missed something or don't quite get something, you can go back and watch the old videos. Also, I recommend taking a look at the comprehension quizzes, because I set those up so that they're due on Friday, and then on Sunday night, the answers are available. So if you missed a question and weren't quite sure why, you can look and see what the correct answers were. And then lastly, also, that problem set that you have that hopefully you turned in, and hopefully that went well, that's a good maybe deep dive on the real intuitions behind a lot of these topics. So that's a broad review for exam 1. Good luck. I hope it goes well. And then in the next videos, we'll start jumping into new material.